first case study, this is going to be all about the value of experiential marketing and creating physical experiences. So go ahead and take it away.
First case study. I was working for a Fortune 500 company and very long sales cycle, multi-million-dollar product. And it's not something that you can just sell online. And at the time, digital was only getting started, but that wasn't a way to sell in this industry. It was healthcare tech. We were trying to figure out a way to really showcase the value of our enterprise system. And the best way to do that was to actually show it in its real environment. But that wasn't very practical. In this case, walking into a hospital and being able to demonstrate your technology across the various departments. So we actually created a replica hospital that was mobile. And as we try to do, we try to be where our customers are, and we took it on the road. And it was a combination of bringing in actual employees who played actors. And at this time, we had hired a number of physicians and nurses and pharmacists who decided to join the commercial side of their profession. And so they actually played roles. But we basically created a replica of the health system and we scripted it. So it was largely a day in the life of a patient based on different scenarios. So whether they're entering into the emergency department and then they get triaged to the ICU, but it was a day in the life of the condition that they are being treated for, but how technology was supporting all of the clinicians. And it became very, very popular because it was mobile. So we ended up taking it to trade shows. We took it to really fun event locations, but it was a way for us to really demonstrate the value based on a replica of the environment that people would be using our software. And it was a novel idea. You didn't really see that in our industry, so much so that when we were doing business with the National Health Service in the UK, and they saw this, at that time, they were deploying nationwide electronic medical records. And they saw this and they went, oh my gosh, we want to replicate this to show to our own community, medical community, what we're trying to undertake here, because it was a very big initiative to roll out a nationwide EMR system. But they loved it. And when we would take people through the tour, they could imagine themselves actually in that role. But we did it based on the value that we're providing to the providers, to the health system, and to the patients.
Yeah. So, all right, I gotta jump into logistics, which is not normally my background, but now I'm fascinated with how do you do this? Do you have like 4 semi trucks and you just unload it and build it, or give us help us visualize what the whole thing looked like?
Yeah, we brought in actual architects to help us design it. And then we had a traditional exhibit house build it once we came up with the concepts. We used graphics, but then we also found a vendor on the East Coast that would supply all of the hospital beds, the actual things that you would see in a hospital setting, so that it was believable. And the initial build, yeah, there was an investment in it, but when your technology is a multi-million-dollar and technology that you're selling, it was an easy value prop to really pitch. But it was like taking your trade show booth on the road. It just happened to be a non-traditional trade show booth. It was a replica of a hospital, and we would have people come in and build it. And pretty soon we knew how to do it ourselves. But it did require a little bit of orchestration, but it was very, very, very valuable in selling our product.
How big was it? So how many square feet and how long did it take to set up?
It was 40 by 100.
Okay.
40 feet by 100 feet.
All right. I'm trying to think of all the hospital jokes now. Did it have bad music in it?
We had 10 by 10 spaces that were partitioned off, so walls, and each one represented a different department, including the physician's or the patient's home. So if a patient was searching for care, we even had a setting based on that scenario too.
Yeah. Clearly, something like this is a pretty interesting idea. It feels like it makes a big impact. How do you measure the effectiveness of it? Did you do any survey data? Did you have any markets where, hey, we took this experience and we closed higher? Help us understand how you measured the success of it.
We measured it based on revenue impact. And so whether it was at an event, we also hosted our own executive summit. So we started to couple different types of events with this as a demonstration tool. And we basically measured it on who went through it and what business did we did we land? So, when we think of it today, we think of a demo as a big conversion opportunity. If somebody gets to a demo stage and then they become a legit opportunity, this is a demonstration on steroids. But
Yeah.
we calculated based on revenue coming in. But the other piece of this though is other people started to replicate what we had created. And so when you have the National Health Service out of the UK, they want to do it. We even had a major trade show association start to replicate, but they were bringing in other industry partners. It really got a lot of traction. There was a lot of buzz around it because up until that point, Steve, if you had any such thing, a lot of the times you had it at your corporate headquarters. People had to come see you to
Yeah.
see your vision center. We said, well, that's not very practical. Not a lot of people aren't going to travel into your headquarters. We're going to take this on the road and show it. And I think by doing that, we had more people going through our demonstration of the enterprise technology.
Yeah. No, I think it's a great idea. I wonder if today would you test like a virtual reality system? But I am with you on there's just something about physical spaces that capture attention. It's tangible, you're touching things, and it's just you've got someone's attention, like someone spends 10, 20 minutes in there. That's a great brand experience.
It's the show, don't tell. But think about it from the standpoint of the metaverse. So now we're trying to replicate physical experiences in the metaverse. At the time that we were doing this, we didn't have the luxury of advanced technology where you could create this in a digital way. And by the way, you just hit on something else, which is the physical interactions that we have, the face to face, the relationship building is us being in the same physical location. We should never underestimate that, no matter how advanced technology gets. And I think in this case, creating this experiential environment where it was hands on, you could ask questions. You were following a story, and the story just showcased the value at different moments in time based on this patient. It's very, I'd like to see marketing get back to really valuing that, especially for enterprise software. There's no replacement for being in the same physical location and doing that. But it is interesting to juxtapose that over the metaverse, where they are creating these digital worlds and trying to make them as real as possible. So it was one, in our case, it was physical. Now you've got the metaverse where you could basically just build this out in that environment.